Hi, everybody. I'm Emily Price, the Executive Director of Healthy Birthday, Inc., the nonprofit that created the Count the Kicks public health campaign. And I'm thrilled to have with us today Dr. Ruth Fretts, who is a member of the Count the Kicks Medical Advisory Board. Hi, Dr. Fretts. How are you doing today?
Hi, Emily. So nice to see you. I wanted to congratulate you on your work with Count the Kicks because I really think it's an important public health campaign for women.
Thank you so much. And some people may not know this yet, but Dr. Fretts is part of the research which eventually launched Count the Kicks and created Count the Kicks here in Iowa. There was research out of Norway that showed some really promising results, that when you educate and empower expectant parents to track fetal movement, that babies can be saved and preventable stillbirths could potentially be prevented. And so you've been at the forefront of this research and this knowledge for quite a while now. And we're so glad that you're a member of our medical advisory board and willing to talk to us today as COVID-19 continues to be something that we watch and continues to affect the United States. And so we'd love to talk to you more about what does the evidence show about kit counting and why it's important?
Well, briefly put, a healthy baby is an active baby. And when people have seen their 18 or 20-week scans, usually the babies are very active. And as the baby grows, the baby will have different sleep and wake cycles. And most of the effort has been put on evaluating or reminding women to be mindful of fetal movements. Specifically, we take that extra time at 28 weeks. The importance of fetal movement, again, is it's an inexpensive test of well-being. And so if you have an active baby, then you have a healthy baby. In Norway, they introduced guidelines and information. And since it was relatively new, the idea that if you quantified the movement of the baby to give women tools, they reported decreased fetal movement. And subsequently in the before and after design, they had a 30% reduction in stillbirth. I think it's really important because for any family who's had a stillbirth, it really changes their life. And a certain number of these could be prevented. And I think that your efforts to help empower women know when to worry is so important.
Well, thank you so much. We're so thrilled to have your expertise and the knowledge that you have to share with us today. You're also a practicing obstetrician in addition to being a scientist and someone who studies this and researches fetal movement and other things. What is the number one thing that you are telling to pregnant women right now during COVID-19? What do you want women who might be expecting to know as we talk today?
Well, more visits are becoming remote. And so there'll be education, reassurance. And I think it's more important now because some people might come to an office and say, well, you know, the baby's not been moving very well, but since I was coming, I thought I would just save my questions to my visit. And what we really want people to learn or to communicate is that if they have concerns about their baby, there's a couple things they should do. They should be mindful of it. And I try not to scare people, but my pitch is to say, as I said, that an active baby is a healthy baby. We also encourage people that if they have concerns, is to call their doctor. And it's okay to have a false alarm, to arrive to the hospital, and then they say, oh, the baby's moving just great. But it really does need a thoughtful evaluation because those people that present with decreased fetal movement, they have a 4 times higher risk of having stillbirth. And they are also more likely to be diagnosed with growth restriction. So when someone says, oh, my baby's not moving well, you really need to do an assessment of what are their risk factors. You know, some risk factors for stillbirth are advanced maternal age, obesity, smoking, and other medical risk factors. But you do need to have a thoughtful review each time you have a complaint.
Now might be a good time to remind folks that our app is completely free. It is available in 12 languages, and you can download it for free in your app store, whether that's Android or iTunes. And again, it's totally free. And this is where you can have your daily kick counting sessions. You tap the footprint on the screen every time you feel a movement, as Dr. Fretts said, a kick, a jab, or a roll. And then the app times how long it takes to get to 10 movements. And so let's talk a little bit about some myths and how myths play into tracking fetal movement. There used to be education on as long as you got 10 movements in 2 hours, you were fine, your baby was fine. That's not the case anymore, because what recent research is showing is exactly what you're talking about, to time how long it takes your baby to get to 10 movements and get to know what's normal for your baby, because every baby is different. It might take my baby on average 30 minutes to get to 10 movements, and Dr. Fretts, it might take her baby 5 minutes on average to get to 10 movements. So would you mind talking a little bit more about why getting to know what's normal is so important compared to, say, a 10 and 2 or something like that?
I think that women are more savvy now, because you don't really want to wait till the baby stops moving. Like, we don't want to hear that. We really want people in the middle of the night if they have concerns. Now, one of the things is that some people are so busy, they forget to be mindful. And there are only so many things you can keep track of in a day that people at the end of the day might say, I wonder if the baby moved. Well, that's especially an important time to, lie down and be mindful of the movements. It's a myth to say drink something sugary. I think it just gives people more time to be mindful of the movements. And also, I think that it's good for women to trust their gut, because I know women worry in pregnancy, but women, of course, when you have a live-born baby, you're going to be mindful of that baby, and so if the mother thinks there's something wrong with the baby, then we should be listening.
Absolutely. Another myth that women come to us with is they've all been told that babies run out of room at the end of pregnancy, that your baby somehow is moving less because they've run out of room. And that's not true, right?
So it's not normal to slow down. And that would be a reason to call your doctor, because late in pregnancy, some things can happen that we want to be listening to the baby. So it would be an error to say, oh, it's okay, the baby slows down late in pregnancy.
How do you suggest that doctors, with so many more virtual and online appointments and telehealth appointments, how are you suggesting doctors talk to their patients about fetal movement during COVID-19?
Well, I think we have to talk about really the reasons why people should worry. And so other things that can happen late in pregnancy, like unsuspected hypertension. Some women are getting blood pressure cuffs, they're getting urine dipsticks, because they're trying to avoid the environment where there may be COVID patients. But I think at each visit, people have to, especially during the time of reduced visits and having more virtual visits, that is a vital sign. And I think it's more important than ever to keep reminding women, pregnant women, to really advocate for themselves. If they have a concern, if they have way too much swelling in their legs, or they have headaches, they really have to advocate for themselves, because the scheduled visits may not be frequent enough to catch those medical conditions that can put both the mom and the baby's life at risk.
So there's a mom sitting at home right now expecting a baby. The number one thing we would love for you to know and understand is, if you're noticing any changes right now in your baby's movements, we want you to speak up right away and tell your provider and reach out to them. We know that there are fears that you may go into a clinic that had a COVID-19 patient in it, or a hospital. But really, Dr. Fretts, we don't want COVID-19 to be a barrier to speaking up and going in, right?
Precisely. And many health organizations have different hospital or different office settings. Some of the office settings would be a pregnant patient who has a COVID exposure, and that would be considered a pregnant COVID visit. And there are other offices that don't have any known symptoms for COVID, and people should come in for that. But and there are times where you have to come in to the hospital. But I think we've learned a lot now with this pandemic and how to manage it, and to have protective gear. Thankfully, the pregnant women that we've seen that have had COVID so far have done well, but it can be complicated. But one thing you don't want to miss are people waiting at home and not asking the questions and not reaching out to their providers, because we have ways of dealing with it, even in the setting of COVID. And so I think, getting out, safe social distancing, getting fresh air, being mindful of your baby's movements, and call. That's what we're here for. We're here to help moms and babies.
That's part of the reason why we added this feature to our app. After moms are done tracking their baby's movements, having that kit counting session, each day they're going to get a graph and it's going to show them how long it took their baby to get to 10. And one of the features we have here is there's a little share button. So you can share your kit counting results either through text or email. You can even share them on social media if you want people to know what your baby's normal was that day and raise awareness about tracking fetal movement. There are some doctors many doctors, especially in this day and age, who are open to receiving a text message or an email that says, this is what my baby's normal was for today and what my history has been. And so that is one feature in the app that moms can use, especially in this day and age, to stay connected with their provider's office and, just to let them know what has been normal and if anything has changed, what it has changed too. And so just wanted to throw that out there as well.
I think that's really useful to communicate with your provider, because a lot of people who are diagnosed with diabetes have electronic records that they're sharing. And the other thing that this app has no advertisements. I, as a researcher, signed up for different apps and just to see what they were like. And I wasn't pregnant, but there were so many commercials. And this is explicitly here to help pregnant moms, help them. And many times it decreases anxiety because they can see that the baby's good movement. They say, okay, this is good. And I would say that really about 6 to 10% of patients are going to be worried about decreased fetal movement at some time. And it's okay to come in and have a false alarm. We'd much rather have false alarms than people sit at home and worry and question their judgment, because we should be listening to moms and babies.
Thank you for your messaging today, for encouraging moms to speak up and to really take good care of themselves this time, during this time and always. And so we also appreciate your expertise when it comes to tracking fetal movement and raising awareness among expectant parents and providers as well. So thank you so much for your time.
Oh, my pleasure, Emily.